Hello, don't you just love Peter Allen's music? Oh my gosh. Welcome to the first Ardenwood Presents webinar in 2025 on Medicare and Your Care. I'm John Mitchell, and I serve as Executive Director and CEO here in San Francisco, where we have beautiful blue skies today. Our webinars are designed to inspire, inform, and educate fellow Christian Scientists throughout the country so that you know the human ways and means, as well as the spiritual truths that can support us in times of need. Thank you for joining us today. And before we get underway, I want to invite you to come to Ardenwood anytime you're in the Bay Area. You're welcome to use our Bible Research Library and study room, to have a delicious lunch or dinner in our dining room, and feel free to bring a friend. And we strongly encourage you to come for a rest and study visit, a time away. Stay in a lovely guest room for a few days to refresh and renew. You won't regret it. You will love it. Please call our front desk to make a reservation. You and your family are welcome at any time. You know, as a 501c3 charitable nonprofit organization, Ardenwood supports the Ministry of Christian Science Nursing with the expectation of full healing. We provide skilled Christian Science nursing care, we offer Christian Science nurses education and training, and we present online events like this one. Your financial support of our programs and services is essential, and we're thankful for each and every donation, truly. And now let's talk about today's webinar. Why is Medicare important for a Christian Scientist to know about? Well, because it's a big help when it comes to paying for skilled care. Now, skilled care is a level of care someone would receive in a hospital, and it's expensive. We've all paid into Medicare throughout our working lives, paycheck by paycheck. Hopefully, one will never, ever need skilled care. But if one does, Medicare is a payment option for those who are 65 and over. And let me make a very important point here. There is no difference in the care you receive at Ardenwood if you are on Medicare or not. It's exactly the same care. And by the way, we are not endorsing Medicare in these programs. We're pointing out how Medicare can help pay your bill. Ardenwood is designated in federal law as a religious non-medical healthcare institution, or RNHCI, RINKI for short. As a RINKI, once again, a religious non-medical healthcare institution, Ardenwood is a Medicare Part A provider. One misperception of Medicare is that it wants too much information about your physical well-being. As the payor, in this case, Medicare simply wants to ensure that the care received should be covered. That's it. In other words, if you weren't at Ardenwood or another RINKI facility, your care needs would require a hospital setting. That's that level of care we're talking about. As you know, Christian Science nurses do not diagnose. So we report only general information to Medicare. From many years of experience, we have found Medicare to be a much less intrusive and more reliable than most insurance companies. I also want to emphasize here the wisdom of having a care plan and of sharing it with your family or designees. If you go to a Christian Science care facility, like here at Ardenwood, you want your focus to be on God and healing, not on how to pay for your care. Thinking through your options in advance is a support to your healing. It's also support to those who love and care for you. Share it with them. One last point. Medicare can be very helpful if for any reason you find yourself in a care setting that is not your first choice. And this is where the importance of having an advanced healthcare directive, or AHCD, comes into play, something we'll be talking about in this presentation. Finally, the content shared today is only informational and is not intended to be legal advice. A replay of this webinar will be available on our website, ardenwood.org, in the next day or so. Replays of all of our webinars are also on our website, and you are welcome to share any replay with family and friends. Now, let me introduce our presenters today. Jim Maher is a certified senior advisor and a broker consultant specializing in Medicare. He's also a certified long-term care insurance strategist. Jim has talked to literally thousands of Christian scientists since our first webinar, 5, 6 years ago,
Right.
answering innumerable questions about Medicare, long-term care insurance, and estate planning. He's a tremendous resource and a blessing to our field. Katie Burris is a Medicare specialist and certified long-term care consultant, helping individuals with their Medicare and long-term care planning strategies. Katie is a partner at McGrew and Maher Insurance Services and has been in the business nearly 20 years now. She is licensed for life insurance, long-term care insurance, and Medicare in several states. Katie has talked to almost as many of you as Jim has. And from what both Jim and Katie have said, they love meeting and working with all of you.
Absolutely.
Thank you. Thank you. Nancy Sedan is our Director of Finance, and in her work for us here at Arden, she has gained extensive experience working with Medicare and other health insurance policies. She too is happy to answer questions. Today, Jim, Katie, and Nancy will provide an update on Medicare plans that best serve Christian Scientists, and then we'll answer your questions. As a reminder, you can ask questions using the Q&A button at the bottom of your screen. Let's get started. Jim, Katie, and Nancy, it's all yours.
All right. Thank you, John. We're pulling up the presentation here. So thanks for the nice introduction. And we're going to tell you a little more about ourselves, right? That we've been doing this I've been doing it 35 years now, and Katie's been doing it 20 years. So combined 55 years. But I wanted to let all the Christian Scientists know out there too. I know our last presentation, we had a lot of calls and emails, and it happened during Medicare's open enrollment period. And I've never seen anything like it, honestly, as long as I've been doing this 35 years. We were overwhelmed. We had so many calls and emails. So if you sent us an email or left us a voicemail, we didn't get back to you in a timely manner, please forgive us and feel free to reach out to us again. We never intentionally not call back or don't reply to an email, but because of all the changes last year, there's so many that we were overwhelmed with literally thousands of calls and emails. So anyways, that's kind of the update. John introduced me. Katie,
I'm Katie Burris. Together we're McGrew and Maher, and I've only been doing it for 20 years. So we're broker consultants who specialize in Medicare and long-term care. We have to tell you, we're not affiliated with Medicare, Social Security, CMS, or any other government agency. We're completely independent. So when we're talking about the term original Medicare is what you get from the federal government and has two parts associated with it. Part A is the hospital or Rinky side. We're going to go over that. And that is premium free. Not a term we love.
So it's really not premium free. There's no additional premiums because you, like John said, you've been paying into this your entire life. Every time you get a paycheck, right down on the bottom, it used to be a stub. I don't know what it is now, some kind of email, but you can see 1.45% is withheld for Medicare taxes, and then the employer matches. So it's not free. We've simply paid for it in advance, and there are no additional premiums. That's how it should be phrased.
And then part B is the medical insurance side. That has a premium of at least $185 this year per person. It can be more depending on your income, and they're going to be looking at your income from 2023. And that's what Social Security will use to figure out that premium cost. If you have any questions, you can always reach out to us. And there are 3 times and 3 times only that you can get Medicare A and B. The first time, it's referred to as the initial enrollment period. And it is the 7-month window when you turn 65. So you have 3 months before your 65th birthday, you have the month of, and 3 months after. And it's full months. So let's say your birthday is April 16th. You have from January 1st all the way until 3 full months after your birthday. So you have 7 full entire months. The second time a lot of people use is a special enrollment period. And that's if you've been working for a group plan with more than 20 employees, that's the caveat, and you retire after you turn 65, at that time you can get Medicare A or B.
And that would include you or a spouse.
Mhm.
So if you're over 65 and you didn't enroll for Medicare because you're on a younger spouse's group health plan, then you're okay. But when your younger spouse, when they reach Medicare age, then that would be the time for you to also enroll into Medicare. And then there's no penalty. You're protected by that group health plan.
And then if you didn't enroll in either of those two instances, then there is a third time that's referred to as the general enrollment period, which runs from January 1st through March 31st. And we're going to talk about that in more detail since it's happening right now.
And that's important for Christian Scientists because we found a lot of Christian Scientists, you may have Part A only, and you may look at adding Part B. Well, now's the time to do that.
So with Original Medicare A and B, you can see any provider in the entire US or territories that accepts Medicare. So as long as they take Medicare, you can see them.
Right? There's no list.
No, there's no
People
list.
always think when I go into Medicare, is it like a PPO, like my work plan? And because that was pretty big. Medicare, Original Medicare is better because any provider throughout the United States, including all the Rinkies, like John mentioned, all take Part A, and most 94% of physicians do take Part B out there also.
So once you have Original Medicare A and B, you have that red, white, and blue card that has an 11-digit encrypted number. No longer does it have your social. So for years it did. If you happen to have a loved one, family member that's older that has two Medicare cards in their wallet, or they have the Medicare card that still has their social, they need a new Medicare card, or if they have both, take the old one out.
Right. And it's really simple. If you have that old one with your social security number on it, you want to destroy it, you can really simply call 1-800-Medicare and get a new card. They're really easy to deal with and they send them out pretty quickly.
And then once you have Original Medicare, then it's up to you to decide if you want additional coverage. Do you want insurance? The option one is a Medicare Advantage or a Part C plan. So with Medicare, it makes it really confusing because so many times there's 2 or 3 terms in some cases that mean the exact same thing. So if you ever hear the term Medicare Advantage or Part C, they mean the same exact thing. With Medicare Advantage plans, people enroll in them because they're low cost. Sometimes they'll throw in some freebies. But what you see, that big font, all the fun stuff that they include, it's the small font that takes things away that you need to be aware of.
That's exactly right. And for Christian Scientists, this is not an ideal plan for you. A lot of you we've talked to have this plan and you signed up for it because I don't think you bought it. I think you were sold saying, listen, if you don't have it, there's 0 premium plans out there. Basically, anything you see on TV is a Medicare Advantage plan. The problem with that being is there's no Rinky, there's none on their list, right? So you're outside of a network and you need referrals and everything sourced to get into to see a provider. So that's not a great choice for Christian Scientists. And if some of you have it, we're going to show you how to get out of that and go back to Original Medicare today.
And I know, Nancy, you've talked in the past about how that doesn't necessarily work super well at Ardenwood or other Rinkies.
Yes, there's an issue with Medicare Advantage plans. If an individual has their Medicare benefits through a Medicare Advantage plan, Part C, as Katie said, they will need a pre-authorization. The plan needs to give you a pre-authorization to come to Ardenwood. So this is unique to Medicare Advantage plans. So if you have Original, you just come. And getting this pre-authorization can sometimes be hard because they're trying to figure out what your care need is, and then they don't recognize what a RINCI is, a religious non-medical healthcare institution. So sometimes it takes a while before they approve you coming. And so that's just something to be aware of, that's one of the things. On the end side or the billing side, when your care needs are complete and you've gone home, um, when we have to bill the Advantage plan, again, we run into the same hurdles. They don't know what we are, and of course, we don't ever diagnose, so they don't have information about what kind of care need was being provided for. So that throws them for a loop as well. So both of those things are negatives, I would say, with regards to a Christian Scientist having a Medicare Advantage plan. That said, sometimes people feel that that's the right thing for them, and of course, it's an individual decision. But we just want to make you aware of those two other major issues.
Yeah, thank you, Nancy.
So the second option is referred to as a Medicare supplement plan or Medigap, again, two phrases, same thing. And with the Medicare supplement or Medigap plan, your Medicare A and B stays primary. So you don't have the insurance company that is requiring prior authorization or pre-approval. If Medicare approves, the supplement also pays.
That's exactly right. And that's what we normally recommend if a Christian Scientist wants to go beyond original Medicare. And we're going to talk about the co-pays and everything in a minute and why it may make sense for you. And again, like Nancy said, Medicare is so individualistic. It really is. What's good for you may not be good for your neighbor or your pickleball partner or your bridge partner, but it may be the best for you. So everybody is different. And that's what we want to get across, right? If this is something that's going to help you, then maybe you move forward. And if not, you're good with where you're at, but we want to explore those options.
Mm-hmm.
And I should say that many of our Medicare level patients have a Medicare supplemental policy and have found that helpful, as you'll find in the next couple of slides.
Yes.
But indeed, Part A Medicare and a Medicare supplemental are a good pair and cover a lot of the, if not all, of the costs of Medicare level at a RINCI, as such as Arden would.
Thank you, Nancy. And then when we're talking Medicare supplement plans, we're going to talk Plan G like George, because it's the most benefit rich plan available to most people. And so that's the one that we're going to go over. We're going to go over kind of how that works. And then in addition to a supplement, you can get a Medicare Part D prescription drug plan, but that's optional if you want to do that. Most Christian Scientists don't.
Exactly. So big news is what's happening now. Well, a couple things, and both of them pertain to you. First off, the general enrollment period. That's the time Katie went over, January 1 to March 31st. If you have not applied for A and or B, now's the time to do so. There may be a penalty involved, and we'll talk about that, but now's the time. You can't just randomly say, gee, it's April, May, June, July. I think I will sign up because I'm ready to do so. That's not how the government works. They give you this time frame, and you want to take advantage of it, right? You want to look and say, okay, if I haven't signed up for B, what's the cost going to be, and should I move forward? And that's what we're really good at going over with you and kind of determining if that makes sense or not.
So between January 1st and March 31st, there's two different things happening, and they apply to different people. So the first one being that general enrollment period, that is people that are not on Medicare A and or B, and they want to apply. And they didn't when they were 65, and maybe they worked for a while after 65 and they didn't when they were retired. Then the other thing happening during the same time period is referred to as a Medicare Advantage open enrollment period. And this applies to individuals that are on Medicare A and B and have a Medicare Advantage plan now. And there are some things that they can do during this time. So let's go over the general enrollment period a little bit more. So we're in it. It started January 1st. It will go until March 31st. And during this time, you can add Medicare A and B, add just Medicare A if you want to. Keep in mind, if you want Medicare B, you have to have A. You can't just have B.
Right. And I'm guessing most people do have A, right? If you're collecting Social Security benefits after 65, they require you to at least have Medicare Part A.
So Jim talked about that you may be subject to a late enrollment penalty if you haven't signed up for Part B. So the way that penalty is calculated is there is a 10% penalty for every 12 months that you should have had Part B and didn't. So that would either be from the later date of when you turned 65, or if you were working for a group plan after you turned 65, let's say you didn't retire until 70, that's when the penalty would apply, when you were 70 instead of 65. So if you add Medicare A and B during this time, or you add B if you only had A, this is when you can also look at adding an insurance plan. So you can add either a supplement or an advantage plan during this time. The other one is that Medicare Advantage open enrollment period, also running until March 31st. I know it's so confusing.
It really is. So just having one big one. So if you put me in charge, I'm going to make it October 1 to December 31st for everything, because we just got out of the other open enrollment period, October 15th to December 7th. People get overwhelmed with Medicare. No wonder everybody's confused. There's so many options and penalties if you don't do the right thing.
So this, again, this Medicare Advantage open enrollment period applies if you have Medicare A and B and you're currently enrolled on an Advantage plan. Not if you want to add one, but if you already have one. So during this time until March 31st, you can drop or switch your Medicare Advantage plan. Question that we get asked frequently is, how would I know if I'm on an Advantage plan? And the kind of key giveaway is that highlighted in that right corner where it says Medicare RX. That would tell you that that plan has prescription drug coverage. Right. In addition, in this case, I just used a sample ID card, but it says HMO and then underneath it, a Medicare health plan. Anything that says HMO or PPO on it is a Medicare Advantage plan.
And a lot of Christian Scientists, you've signed up for that, right? You were sold saying, well, it's better than nothing. You might as well get it. It's a low cost or zero premium plan. And then a lot of you told me, well, Jim, I'm starting to get this penalty notice. Why am I paying at zero premium, but why am I paying $40 or $50 a month? What is that all about? And that's because if you've never had a Part D prescription drug plans, which most Christian Scientists don't need, right? That's the additional prescription drug plan. Well, these are built in. So if you purchase this, if you're not dealing with Christian Scientists, they're never going to think to tell you or know about it. But that would start a penalty, right? Because you've never had it. So this would be the opportunity to go back to original Medicare, right? Mm-hmm. And get rid of that plan if you so choose, but also get rid of the penalty.
Yeah. The other thing that you can do right now is if you're on an Advantage plan, you can drop it and return to original Medicare. So have that be your primary. So even though with a Medicare Advantage plan, you have to have Medicare A and B, the Advantage plan takes over and becomes your primary. If you don't want that anymore, you can drop it, go back to original Medicare as your primary, and then you can decide whether or not you want to add a supplement plan at that time. Keep in mind, if it's been more than 12 months since you were on Medicare and the Advantage plan, then you would have to answer health questions in order to get the supplement. Although most Christian Scientists can answer the health questions.
Right, they're all no
Yeah.
normally.
Yeah.
So yeah, that's a positive.
So the next part we're going to talk about is Part A of Medicare. So I know we kind of mentioned that a little bit. So Part A is the hospital side or works at RINKES, the Religious Non-Medical Healthcare Institution. It would cover care in a hospital, or if you needed a hospital level of stay in a RINKE. And then the coverage is nationwide, including any RINKE in the US. And then here's a map of the current RINKEs. I know that I should have made that font a little bit bigger.
Well, it kind of shows you right where everything is. So that's good. But again, every hospital in the United States, everyone takes Medicare. So if you're not in a RINKE and you're in a regular hospital, every single one takes Medicare Part A.
So with Part A, if you needed to go into a hospital or a RINKE for that hospital level of stay, there are costs associated with it. So for the first 60 days that you would be in a facility or a hospital, you're looking at a cost of $1,676. If you still have to be in a hospital or a RINKE, and it's now day 61, and it's still that hospital level of stay that you need of care, you're looking at a cost of $419 per day. And that's for the facility. And then if you're still in the facility on day 91 through 150, it would be $838 a day. The thing to note is if you just have Medicare A and B or just have Medicare A and the stay exceeds 90 days, anytime you get to that 91st day or longer, you're pulling from what Medicare refers to as lifetime reserve days. So you have 60 days lifetime to use for a stay in a hospital or a RINKE for that hospital level of care at any point in your lifetime. So once you use those would be considered to be gone.
I'm going to show you the grand total.
Okay. So if
That's
you
scary.
needed, so let's say you needed 150 days, you're looking at a total cost of a little over $64,000.
And we don't see this very often, but I think some people have experienced it before, maybe at Arden would. But we're going to show you how not to worry about that big number.
Yep.
Okay.
And when we're talking about that deductible and stuff, the deductible or these costs would apply if you're in a facility even more than once in a year. So some people think if you meet that deductible, you're done for the calendar year. That deductible would apply anytime that you are outside of a hospital or a RINKE for 60 days or more, or if you go back within 60 days for the same condition.
Right. Then we'll start over. But we have great news. Okay. So we have good news. We have to show the reality. Now we're going to show you how to take care of this. So I have Plan G. We talk about Plan G out there. Why is Plan G your hero if you go inpatient, whether it's Ardenwood or another hospital? That's the reason right there. The Supplemental Plan G pays 100% of your costs. So whatever you're charged, right, as long as you're admitted as an inpatient under Medicare, you pay zero, nothing, right? You have to pay the insurance company a monthly premium. But if you look at the overall cost comparison, what would happen in a catastrophic event, you're way ahead. And you protect your money to be able to help other fellow Christian Scientists or Ardenwood, or it just gives you more options, or your adult children.
So Part B is the medical side. What we see most often for Christian Scientists is they use the items in red. So we see like if you need an X-ray or if some sort of emergency happens and you need to go in an ambulance or an emergency room, those are the ones we see are most commonly used.
And if you don't even have Part B, that is super expensive, especially in the San Francisco or Bay Area. It's incredibly expensive. right? So, but B would cover that.
Mm-hmm.
For an ambulance ride, like I know John's shared, if something happened and they've taken him to a hospital via an ambulance, those bills are horrific, right? When you look at them, but at least Part B would provide a buffer. They have a deductible this year; it's $257, which means you pay the first $257, and then after that, it's kind of an 80-20 plan where Medicare is paying 80% and you're paying 20%. That's assuming you don't have any kind of supplemental or Medigap plan. But being on the hook for 20%, I mean, we've seen MRIs billed out, right, at $20,000, $30,000. Emergency room visits anywhere from $10,000 to $15,000. So normally, I think it's prudent for people to look and go, it doesn't make financial sense for me to spend monthly premiums to take care of that. And again, that's a personal decision. Some of you say yes, others are happy saying, well, if I have at least A and B, then I know I've got some type of a buffer, right? Paying 20% of Medicare approved rate is better than paying 100% of a non-approved Medicare rate. It is.
So if we look at the example, if you have that Medicare supplement plan G, then you would not pay that 20%. You would be covered in full after the deductible.
Yes.
So that's one of the reasons that someone would look at picking up the
Right.
supplement plan G to help with costs.
It kind of gives you peace of mind knowing that if something does happen, and we hope nothing does, but reality sets in and things do happen, and that's your out of pocket for this year. If you have that plan, after $257, you're covered in full. The problem with just having, Katie, if we back up, like we go, if you just have Part B and you pay that 20%, there is no cap. There's no annual cap. A lot of you, when you've been on a group health plan, there's an out-of-pocket maximum of this year. It's probably between $3,500 to $7,000. So at least you have some kind of ceiling. When you hit that, you're covered at 100%. With Medicare, with original Medicare, that 20%, there is no limit. If something happened to you and you broke a bone or fell and broke a hip, you're going to be paying 20% of that if it's outpatient, and that can get expensive.
So the other thing that we need to talk about, one of the most misunderstood things is that Medicare does not cover long-term care, period. So when we're talking about Medicare, that's a question we get asked most frequently, is if Medicare covers it, because we get calls every single week from adult children whose parents are in a hospital or need to go and have long-term care, and they want to know, how do they pay for that? Does Medicare help pay for that? And they don't.
Right. So there's a difference, right, Nancy, between skilled care and custodial type care. And I know at Arden, I know that's a question we get asked quite often. If I come in under skilled care, is that still considered Part A, Nancy?
So long as the care need qualifies, it is Part A. It's covered by Part A. But not every patient that comes to us is at that level. They have lesser needs, and our Christian Science nurses can provide that care. We at Ardenwood are always expectant of healing. And so we never think about, this is a long-term care case. We would never think that way. We expect progress and healing. So that's just our
Right.
view, as I'm sure
Right.
it is for everyone else as well.
Right.
But that being said, sometimes there are reasons why someone might want to have some type of insurance that would help. And that's what Katie and Jim are going to share with us.
Right. Yeah. And we're just going to briefly touch on this. I think we're doing another presentation in March. But long-term care planning is important. And we see Christian Scientists that are married to non-Christian Scientists. And there's ways to protect your family and your assets. Normally, that's what it comes down to. Self-funding, that's what most people do right now. You're going to use your assets, whether you have money set aside in a CD or whatever real estate, whatever you're going to liquidate to pay for that type of care if necessary. Medi-Cal in California or Medicaid nationwide is normally not a great option. Most Christian Scientists, it's not a really good option at all, but it is available. But you really have to almost impoverish yourself to go on to Medi-Cal or Medicaid. The third option is insurance. Most people aren't jumping up and down and saying, hey, I want to buy a long-term care policy today. A lot of long-term care policies that have been around for years, that have been sold since the late 70s and 80s, it's kind of like buying car insurance or fire insurance, right? You're buying it and you hope that you never use it. Well, a lot of those plans that people, and you have, I know a lot of Christian Scientists have had plans through Mutual of Omaha, and there's several companies out there, and they call us and they say, hey, I bought this years ago. They said it would never go up, but now it's gone up 3 or 4 times. Those policies are kind of antiquated. They've had massive rate increases, and they'll continue to have rate increases too. It's really sad, but that's just what happened to the industry. So today, just briefly, 30 seconds, there's a new way to protect yourself if you're interested. And we're looking at companies that are Christian Science friendly, and that is not easy to find out there. Christian Science friendly means, listen, they'll look at your health based on answering health questions. Most of the time, they don't do that. They want medical records or take an exam or something. But we found the benefits of an asset-based long-term care plan. First off, it's a life insurance policy, and you're going, why do I want to buy a life insurance policy if I'm looking for long-term care? Well, the first reason is because the premiums are guaranteed. Whatever monies you put in there, the life insurance side, they cannot raise those premiums, guaranteed, right, on any type of a permanent policy, but you get some type of benefit. So in other words, if you have X amount, I hate to use numbers, but people always go. So for example, if you have $100,000 in this long-term care policy, however you put it in there over 1 year, 5 years, 10 years, 20 years, however you get it in there, you're going to build a tax-free long-term care benefit, normally of at least 3 to 4 times of what you put in there for long-term care, and just in case you need it. The second is that those policies build some type of cash value. We used to have one that was great. It paid all, if you wanted to cash in, you got all your money back. But most of you, there's some type of cash value. So if you decide, hey, this is not for me anymore and I want to get out, at least you get some money back. Unlike auto insurance or other traditional long-term care insurance. And the third one is if you pass away, you're still going to get a tax-free death benefit. So no matter what you do with these policies, your beneficiaries or yourself are going to get some type of a tax-free benefit. That's all. We just wanted to make you aware of that today, right? That there are options out there.
The most important thing that you need to know from today is that you can call or email either Jim or myself. Either one of us can help. We work together. And there's never a charge to work with us. So the insurance companies pay us to help. So we talk with you, go through the process, and when we help you submit your application, that's how we get paid. And it's the same cost to you, whether you go to the insurance company or whether you come through us.
That's right.
You just get us to help. So instead of having to call the insurance company, and I like to say, you're never going to receive a note in the mail or email from the insurance company telling you that their competitor is better, lower cost, something that you should look into.
Right.
But that's why we're here to help, because we're independent and work with various different insurance companies.
Exactly. And we've had that happen where people have said, gee, we called United Healthcare or whoever, Mutual of Omaha Direct, and can you please help us? At that point, we can absolutely help you answer any questions, but we can't represent you by calling the insurance company. But we're always willing to, if you want to shoot us an email or give us a call, we're always willing to get back to you and try and help you. And again, because I know some of you out there, I apologize, but if we owe you a phone call or an email, please recall us or send us an email, and we'll try and get back to you more in a timely fashion.
Yes. And especially the next few days, please bear with us. We get inundated after these. And so we find that we're getting a lot of calls and emails, and we try to give you a call back or email you back as soon as we can.
Yes,
so we always appreciate your patience very much.
And I think we have some questions and answers now. I believe that John has those, I think.
And then Nancy, I know we kind of talked at the very beginning
yeah.
of it about the Advanced Healthcare Directive, but you always do a great job talking in more detail about that.
Yes.
Sure. Thank you for that. Yes, John mentioned that in his opening remarks, Advanced Healthcare Directive. It's a legal document that you can set up ahead of time to designate an individual that could make healthcare decisions for you were you not able to make them yourself. And this is a document that also asks a couple of other questions for you to think about ahead of time. And this is one of these parts of the care plan that John mentioned as well. Because once you've filled this out and made some decisions, then that's when you want to share it with your family, friends, whoever would be close to you, so they know what your wishes are. This can be helpful if you ever did find yourself in a care facility that you didn't choose and wanted to come to a Christian Science environment or Renke. This healthcare directive allows gives you the authority and your designate the authority to release you from that hospital because you've decided that this is what you want ahead of time. So it's a useful document. We've found sometimes getting an electronic copy of it at Ardenwood is helpful if you live in the nearby area. Our visiting nurse can have a copy of it as well. You might have it on your refrigerator. You might tell your family where it is. And so it's a good thing to be part of your care plan. And you can find a template of that on our website at ardenwood.org. And that gives you a good starting point. And again, it's something that's a legal document, so it's probably something you'd want to run by your attorney before you finalize it, just to make sure that it's correct in your state and has the approval for your care plan. So that's it in a short.
We did have it recently reviewed by council, and they found it to be in good order. I think there were some minor changes that were made. Can't emphasize enough how important an AHCD is, or Advanced Healthcare Directive is. It is absolutely vital. Say, for instance, it happened to me. Well, let's not get into me. We had a longtime Christian Science practitioner that took a tumble in his building here in San Francisco, and the neighbor called 911. And so 911 took this Christian Science practitioner to one of the local hospitals here in the city. Took him, I think, 7 days to get out. He said, I would like to go to Ardenwood. They didn't know what that meant. They weren't familiar with Christian Science treatment, etc. We did finally make it happen after 7 days. And the expense that was involved in that, and just the hassle factor, if that would have been squared away ahead of time, and if he had it available, as Nancy said, on a refrigerator or somewhere, told someone where it was, that individual's wishes would have been honored immediately. Everyone's trying to do the right thing, but know that even sometimes if you have it, say if your husband or wife is with you and says, I want to go here, sometimes the ambulance people are directed to go where they're told to go. Mm-hmm. So you may even ask them, I want to go to Ardenwood. I want to go to wherever I want to go. You're going to where they're going to take you. And then it's your responsibility to get out. No one wants to get sued. Everybody wants to do the right thing. Mm-hmm. So it's just good to have your affairs in order. Seriously. This is really expensive.
So true, John. I was in our church last 2 Sundays ago, and there was a lady, and she passed out. And so we called the paramedics, and they responded. And she finally kind of got her to come around. She says, I want to go to my Kaiser facility. I want to go there. And they said, that's not how it works. You're going, this was in Lincoln area, you're going to the Sutter Roseville facility. She goes, I don't want to go there. She goes, You can figure that out later, but it's just closer and that's where you're going. So they really don't give you an option, John, right? Because they're worried about the liability. What if I took 10 minutes longer and I didn't get her to that facility? What happened if something serious happened? They could be liable. So John's exactly, you don't have that option in an emergency.
I know the instance just briefly. I won't get into my situation too much, but I know the ambulance ride itself, and we had full insurance. I mean, I had full insurance. It was 2.9 miles, as I recall, and it was $5,000.
Oh,
And
yeah,
I paid for that out of my pocket because the insurance wasn't in network or whatever the excuse was. To San Francisco General, now called Zuckerberg San Francisco General, but it's just, oh my gosh. Anyway,
and you know what happens too, John, now. So for example, if that happened to me, I have the supplemental plan. So I'm on the hook for the first $257 because that's outpatient under Part B. So I would pay zero after that. So it just goes to show you never know, right? It's hard to say, hey, you should go get that in case, but that's kind of what insurance is about, right? For the unknown.
We do, we as Christian Scientists, we do view prayer, but also this is a comfort to family members. Right. So anyway, we just leave it there. Got many questions, so why don't we get underway with the questions? Great job, you guys, as always. So let's get into it. First question. I'm in my 70s. I don't know anything about the advantage of enrolling in Medicare, etc. It seems that all of a sudden I'll have to pay, to me, large tax payments. I'm wondering if it's too late to understand my options, even if I can enroll in Medicare.
And it says they don't have A or B, or I don't think they indicated on that.
They didn't indicate in the question, right?
It's not too late, and it's the time of year between now and March 31st to add A and or B. And I know we say it a lot, but it really ends up being a personal decision. And if you want to call our office, we can always talk about the situation is always different for people. So your penalty may only be 10%. It may be 50%. So what kind of would that look like? And we can kind of help you estimate that ahead of time so that there's not surprises. I don't like surprises.
And so just to answer a question too, if you're over 70, I mean, nobody waits till, if you're 70 or older, you absolutely want to turn on Social Security, right? Because they don't pay any more delayed retirement credits, right? Any interest. So you're required to have Part A then. So most of you do have Part A. Now's the time to think about adding Part B and looking at the penalty. And if it's 10 or 20%, you may say that's worth it. But we talk about it. We're happy to kind of go over with you and kind of rationalize, is it worth it or is it not? I mean, and again, it comes down to you think about it, pray about it, and decide if that's in your best interest.
And let's just like to add, I think she mentioned the word tax. And when we say penalty, we're not talking about a tax penalty.
No.
It simply means that the premium for Part B, which is $185, I think they said, per month for someone at 65 might be bigger than that because there's a 10% of that premium that would be added for every year, as Katie mentioned. So it's not a tax penalty. It just means that your premium per month would be a little bit higher if you're
exactly. And that penalty's every month for the rest of your life. So that's something you have to consider also too.
They call it a late enrollment penalty, not a tax. They call it a late enrollment penalty is what it's referred to.
The tax would be if you have higher income and you're paying higher Part B premium, that's a surcharge or a tax. So that would be different. But a lot of Christian Scientists have that also.
Yeah, so just call Jim and Katie. This is what they do every day, all day. And so they know the options. So that's why we're doing these webinars, because it is complex and it's good to get good information. Next up, what does supplemental insurance cover? Now, as some of you know who have been on these webinars before, some of these are questions that you'll hear a few times. But anyway, I'm sure that's not the first time we'll get that question, but go ahead. No. What does supplemental insurance cover?
So can I start with that one?
Go for it, Nancy.
Yeah. So here at Arden Wood, if you came to Arden Wood or a Rinky, a religious non-medical healthcare institution, The Medicare supplemental will cover the Part A deductible and the coinsurance amounts. So they go hand in hand. So again, Part A is original Medicare, and the Medicare supplemental would then pay the things that are out of pocket. So as far as just thinking about the Rinky situation, that's what a a Medicare supplemental would pay. And now they'll show you what all the other things there's that it will cover.
It would do the same thing at a hospital. The supplement would cover your costs in a hospital. In addition, the big thing too is when we talk on that medical side. So if you needed an ambulance ride, John, I'm going to pick on you. So if you need an ambulance ride, if you have Part B and no insurance on top of just having Medicare A and B, you have that deductible. So I think sometimes we just throw deductible around like everyone knows what that means. So a deductible is what you have to pay before the insurance company pays. So for the medical side this year, it's a $257 deductible. And then with Part B, you would pay 20% of the bill after that. So the reason people pick up a supplement, not only to help with the Part A costs in a hospital or Rinky for a Medicare stay, is on the medical side, the supplement would cover that 20%. So instead of having to pay 20% of a potentially unknown number, you cap out at the $257 deductible.
Right.
Great. Next up, besides Part A and B of Social Security I'm paying for, what other insurance should I have to ensure that I'm cared for when the time comes if I need Christian Science nursing care? So again, these are repetitive type questions.
Right. ...
So
now, are they talking about a Christian Scientist nurse or practitioner? Or
what other insurance should I have to ensure that I'm cared for when the time of
so that may
I think they're talking about a supplement. I mean, again, because she has Part A and B.
Right.
So I guess it's a supplement, Part G.
Yeah, again, the supplement, Medicare and the Medicare supplemental, if you had both of those, original Medicare Part A and the Medicare supplemental, a stay at Arden Wood that is at the Medicare level would be covered in full. You wouldn't have to pay the deductible of $1,676 or the coinsurance of $417 a day if you needed care after the 61st day. So those are very helpful. There are other types of care that we offer that is not Medicare level, and those are costs that also can be planned for. And in some cases, the long-term care that item that Jim was explaining could also perhaps cover some of those expenses should they ever be needed.
Great. I have Medicare Part B and a supplemental plan, N as in Nancy, through United Healthcare. If I want to have Christian Science care in the future, if I need it, will the majority of my expenses for care at Broadview or Arden Wood be covered?
If it's under Part A with the supplemental plan, and the answer is yes. Yeah, it would be covered in full, just like a Plan G.
Excellent. When I signed up for Medicare, I didn't sign up for Part A, only Part B. Well, okay.
That's weird.
You get it automatically.
You would have
I think the opposite, right? I probably had A and didn't get B.
Right. Yeah. I'll just read it the way it's written.
Okay.
When I signed up for Medicare, I didn't sign up for Part A, only Part B. So I think this individual just means the reverse. I wasn't aware that Part A covered Christian Science facilities. I thought I would not be going to a hospital, so why sign up for Part A? Now perhaps I should sign up for Part A. Will I be penalized for having years without it? I've never used Medicare as of this day. However, I guess you should have insurance for a time you might need it. So I think there's just,
yeah. But
so I would say,
right.
I'm going to jump in.
Go ahead.
I would say, first off, check your Medicare card, that red,
Right.
white, and blue card, to clarify. It may be that you have Part A only and
Right.
not Part B. Those are so commonly mixed
Right.
up. Sometimes I
Mhm.
say the wrong one when I'm talking because
Right.
I talk too fast. So I would check Medicare card first. So
Yep.
I have not seen it ever where you could have Part B and not
I've
have
never
Part A.
seen that either.
So
Right.
my guess is it may be Part A that you have and not Part B. So then Part A would cover you or help cover the cost in a rinky. So that may be all that you want. It may be you don't want Part B. But if you have specific questions, I know the same thing. Give us a call and we can always
Right.
tell you like how you can look into what you
Exactly.
actually have.
Right.
And we've had patients that come to us and don't think they ever signed up for Part A.
Right.
And again, if you've taken Social Security and you're older than 65, that's automatic, as I understand it, right? And as
That's
Jim
correct.
explained,
Yeah.
we've paid into that all throughout our working years. So
Right.
that's why you're not paying a premium for Part A. But more than likely, that is part of the benefit package.
That's right, Nancy.
We talk to so many people, Christian scientists, non-Christian scientists, all the time, where they go, I haven't signed up for Medicare yet, and we'll be meeting with them and we go, that envelope that you have right there, can we open that? And it's their Medicare card.
Right.
The problem is when you turn 64 and a half, you want a national database, and every insurance company is sending you stuff in the mail, insurance agents, also Social Security. If you're on Social Security, they're sending you your Medicare card. So many times people either put the Medicare card away and forget about it, or it gets tossed.
Right.
And people just don't even realize because they're getting
Yeah.
so much other stuff in the mail. So that's really, really common that someone has it and doesn't realize it, or it accidentally got tossed.
Do you know why some of those advertisements they send you look so much like an official government, something from Social Security or CMS, right? Centers for Medicare and Medicaid Services. They look so much like that and they get so much junk mail. People have a tendency to just start throwing them away. And
that stack of
right,
stuff
that
you
stack.
get. Yeah.
We had one the other day and she did the same thing. She said, I have a stack. I said, well, let's pull that one out. She goes, why? I go, because that's from Health and Human Services. That's your Medicare card. She goes, why did I get that? How did I get that? And it's because you're on Social Security, right?
Mhm.
They go, well, how do you know that? And I go, it's a regulation, right? It's like Nancy was right. After 65 and you sign up for Social Security, you've got to have Part A. It's required.
Got plenty of questions here, and we're coming up on 5 o'clock. I think we
Okay.
definitely have to go over.
Okay.
Is a supplemental G plan compatible with TRICARE for retired military?
I just had that question the other day. Actually, normally you don't need that. TRICARE requires that you have Part A and B, and then TRICARE. You don't need one, quite honestly, but some people do get them, but I don't think you need one if you have A, B, and TRICARE.
We've had experience with people that have service in the past and have TRICARE for life, and TRICARE for life, as Jim just said, did act as the Medicare supplemental.
That's exactly right. Yeah.
Yeah, TRICARE is a great. We've had good success with that. Here's a good question for a Christian Scientist. What is an outpatient visit?
An outpatient visit is one where you don't stay overnight. You come to the facility, and we offer outpatient care. Let's say someone happened to cut their finger and can't quite bandage it with just one hand. They can come to Ardenwood. We would help them with the bandaging and send you back home. So that's outpatient care.
Right. You're not staying here, but you get some good care. So that's something to keep in mind. How to get Plan G? You do have to have Part B first, right? My husband and I don't have Part B. He's 86 and I'm 78. How much would we be paying for B now?
Yeah, that's a personal question. You may want to email us or call us.
Right.
We can give you the numbers, but it's 10% for every year, for every 12-month period that you should have had it and didn't. But you can call us or email us and we can give you the numbers to help you.
Mm-hmm.
Great. Yes, please call Jim and Katie.
And then we help with Plan G.
We help with Plan G. That's right. Yeah. That's right.
My Medicare A and B started on January 1st, 2005. But when does it end? I'm 85. I'm a CS.
It keeps going until you're no longer, till when you go to heaven, that's when it cuts off, right? So as soon as you pass, that's when it stops. Hopefully I said that
Okay.
right. I'm trying to say things
You said
with a Christian scientist.
you said it right. No, we're going to
Okay,
heaven.
thank you.
Absolutely. When does recalibration of cost based on income happen, and how does it happen? Do we need to do anything? Great
No,
question.
you don't need to do anything. Don't you worry.
Yeah.
So what happens is at the end of every year, normally around November, December, is when Social Security announces for the following year what the premiums will be. That's when they set the new thresholds. So in 2024, in November, is when they released the premium amounts for 2025. And then what happens is Social Security goes to the IRS to verify your modified adjusted gross income in 2023. So it's always a 2-year look back. The reason for that is because in late 2024, nobody had done their 2024 tax return because the year wasn't even over. So the latest tax return that they could pull is your 2023 tax return.
Right. And government doesn't exactly take your word for it. That's why they pull your tax return. Right. So
Wait,
like
what?
you said, every 2 years, every year they do a 2-year look back. So it changes. So people are getting these, IRMA, these high surcharge. Well, how come that is? Well, you had higher income. So that's what it is. They pull your tax return in line.
The other thing too, and we didn't mention it during this presentation, we have during a bunch of other previous ones, is if you are subject to that IRMA, that tax for being a higher income earner, if you've had something change, so let's say you've stopped working or now you're working less, you can actually request for a reduction in that
That's
IRMA without having to wait 2 years. And we would be happy to answer questions on that. We have helped many clients get rid of that IRMA or get it reduced.
Great. Here's a good question. I have Medicare Part A. Can I pay my Part A deductible with my wife's HSA or health savings account?
Yes. That's usually they call it 213D eligible medical expense. So yeah, you would be able to use those HSA monies for that.
Great. What is the difference between Part F and Part G?
So Plan F does not have any Part B deductible. We keep talking about that 257 deductible. Plan F does not have that. Plan G does have that. In addition, to have Plan F, you had to be 65 prior to January 1st of 2020. If you're not, if you're young, if you're younger than that, then the best plan that you can get, or the plan with the most benefits, is Plan G.
Right. So, and make it easy, if you're born in 1954 or earlier, you can get Plan F. Right. Mm-hmm. We have clients that have Plan F. Some don't want to move. Some do want to move to Plan G because the premium's a little bit less. And some people go, I don't care. I want 100% coverage and I'm good with Plan F.
And John, I just reiterate that the word plan goes with Medicare Supplemental.
Correct.
Part goes with Medicare Part A or B.
That's so true, Nancy. That's
or letter word with
exactly.
a P in the beginning. Yeah.
See, that's why we're all here. Next question. We've got a few more here. We're just at 5 o'clock. Part A covers hospital level care. What is considered hospital level care? Question.
Well, if for Christian Scientists, it would be care that you could not be providing yourself at home, and that needs a skilled Christian Science nurse to help you. Perhaps it would be with mobility, some kind of a bone issue. I got broken and you couldn't move on your own. That might be an example. And again, it's a kind of care need that if you weren't a Christian Scientist, you would be going to a hospital for. So I hope that's helpful.
Yes, perfect. In a couple of years past the age 65, and I'm a couple of years past the age of 65 and have not signed up for Medicare. Would there be a penalty if I sign up for Medicare Part A this year?
It depends. If you've paid in your 40 quarters, you should be okay, right? It's the Part B side that they're going to penalize you for. But I would highly recommend that you enroll for at least Part A during the general enrollment period, right? Because you, like Nancy and John, we've said we've paid into that our entire life. So it's no additional premium. Part B you should consider, right, depending on your finances.
Here's an interesting question. I had my FSA reject reimbursement request. I had my FSA reject reimbursement request for Christian Science treatment because the Christian Science practitioners do not identify the type of problem addressed. How can practitioners and care facilities meet the needs of insurance/FSA insurance requirements when asked by the patient? Interesting.
That's going to be a Nancy question.
I'm going to toss that to Nancy.
Oh, I think that's more of a Mother Church question. I think every practitioner has is individual in terms of how they bill. Some practitioners will indicate the day of treatment so that the bill includes something like for services rendered on and then the particular dates. I know for the reimbursement plan that Arden Wood has for its employees, that practitioner bills are paid, but only if those things are included. And so if it just says for services rendered and an amount, it also gets rejected. So I don't really know how to answer it further than that.
We do employee benefits too. My suggestion would be to ask the FSA administrator in plain English exactly what it needs to say, what needs to be included, and then talk to the practitioner and see if that's something that they can do.
Right.
I think that's perfect. Exactly. Well said, Katie. Original Medicare is Part A only, correct?
Original Medicare is Part A and Part B. So when people are talking about original Medicare, it would be both parts.
Right. Signed in 1965 by President LBJ. Okay. Just in case anybody's a historian.
History lesson.
Right? Did you know the first Medicare recipient, speaking of presidents, Harry Truman, right? Got the first Medicare card. Just thought I'd throw that in, right? To kind of lighten up.
The factoids are fun, Jim.
That's in case it comes on Jeopardy tonight, you got that.
And you know, I really liked your presentation earlier. So when you think about Part A and B, remember that nice map of America.
That's right.
That's what Part A and Part B. It's good anywhere in the United States.
Yes, that's right.
Original.
So will there be another? I hear an echo all of a sudden. Will there be another presentation on long-term healthcare options? Yes, that's the end of March, we said.
Yeah.
Right. So stay tuned. You'll get that information in March, I believe. Or not in March. It'll be in March, but something in the weeks to come. Check your email. We will have a webinar presentation with Jim and Katie. What exactly is skilled nursing care? Does it include meals? Please give examples of exactly what services the nurse provides.
I'm happy to do that. So skilled nursing care at Arden Wood includes a private room, 3 meals a day, plus snacks offered in between, and the at least a minimum of 3 hours of a Christian Science nurse coming and helping with bathing, toileting, movement,
Cleansing and bandaging.
Cleansing and bandaging, thank you, and general care like that. Now, our nurses also, if time permits, are happy to also read the lesson with a patient, and there's no charge for that. So in general, there's that kind of support. There's also a supervisor of Christian Science nursing who is making sure that the right type of care to meet the need is happening, and that's considered a care plan that's put together to make sure that the care needs are met.
Exactly. A few more questions here. Do you provide counsel for Massachusetts residents on supplemental plans that are supportive of Christian Science unique care needs?
Yes, we do. And Massachusetts is a little bit different, but yes, we do.
Right.
Right. And the Christian Science Benevolent Association in Chestnut Hill is a Medicare Part A provider. They are a Rinky facility.
And we get quite a
You
few
mentioned,
calls from there, actually, from Massachusetts and the surrounding states. Yeah.
Mhm.
I have applied for Part B online, but have not received recognition of that. What to do?
My suggestion would be, I'm sorry,
Go ahead. No,
would
that's
be to
fine.
call your local Social Security office. You can go to ssa.gov and then they have an office locator, and then they'll give you the phone number for your local office. And you can call and just verify that they've received the application. Normally, they send an email letting you know that they've received
Right.
it. So if you didn't get it, there's a possibility that they didn't. So you definitely want to just check with them and make sure.
Or you have an ssa.gov account. If you applied for Part B, in there, it's going to be a verification letter when you're approved. They'll eventually send you a new Medicare card with Part B added, but that verification letter in there is going to state when the Part B or medical insurance, as the government refers it to, is active. So that's another way to check it out also.
Perfect. So here's kind of a long question, and then we've got one more after that. I have Part A and Part B. Would I incur a penalty now if at age 79 I took a supplemental plan for the first time?
No.
So supplement plans don't charge penalties. Only Part B does. The only caveat on the supplement plan is you would have to answer health questions, and we can go over that with you. So we would always go over the health questions beforehand. We wouldn't have you submit an application until we went over the health questions because we don't want to have you apply or have any issues. So we would go over that first.
So my
And
answer,
the cost of it too.
so my answer no wasn't correct, right? Well, technically it was no, but Katie's
I
right.
have to give more
She's
information
right.
than
That's
that.
that's very good. No, that's true.
Good.
I can't just say no.
Yeah.
Please explain the scenarios about how a Christian Scientist is penalized if they ever used medical treatment. 2A is kind of a subset here. It could happen even without your consent, but you really yourself would choose only Christian Science treatment. And then 2B says, when you are again able to speak for yourself, how long does it take before you're able to get Christian Science care coverage since you have been forced to go to the hospital without your consent, for instance? This is where it gets tricky.
Right.
Well, let's address the second one. If you have an advanced healthcare directive, and let's say you in that directive you had specified that if you needed care that you wanted to go to a Rinky to receive that care, then the person that you designated to be your healthcare power of attorney within that document can go to the hospital where you are and present that document and follow through on your wishes. So if you have that document, it could happen as soon as the facility could take you. So I hope that answers that question. John, could you read the first part again?
Right. Please explain the scenarios on how Christian Scientists is penalized. When you're able to speak, when you're able to speak again for yourself, how long is it before you're able to get Christian Science care coverage since you have been forced to go to the medical or hospital without your consent, for instance?
Okay, well, I think I answered that part. There was something about the being
I think Steve might be talking about a revocation.
Yeah.
Um,
And I wasn't sure if that is the case. It's a little complicated to go into, but Medicare does have certain rules having to do with our Rinky benefit. Um, and basically, the idea is that if you have a need to use your Medicare benefit, and you come to a Rinky first, you're going to put something in place called an election. You can read more about this on our website. We have a booklet on Medicare and Christian Scientists, and it's something that you could read again because this may be a little condensed. But so when you come to Ardenwood and you have a care need that meets the Medicare criteria, you sign an election that basically says, I object to medical care and I want Christian Science care, or I want to have care in a Rinky. So you're making an election. You're saying, I want my benefits here, not in the medical. And so that goes into Medicare's files. And should you, after you go home from the Rinky, and at some point later in your life, if you needed to seek medical use with your Medicare card, that is in the system they would quote revoke your election because now you're using your Medicare in a nursing in a medical facility. And you're allowed to do that once and still come back to a Rinky and have your Medicare benefits pay. So you're in a Rinky, next time you need medical, now you want Rinky, you've revoked it once, you're fine. But if that happens again, and now you go back out to the medical and it's revoked a second time, then there are some penalties. You can't use your benefit for a year at a Rinky. It's quite complex. It's not something that happens all the time. And again, if that is something that's relevant, please feel free to look at the booklet on our website, ardenwood.org, Medicare and Christian Scientists, and it explains that more in detail.
It's a great booklet. I've actually printed it off and I reference it sometimes when I'm talking with people. It's fantastic.
Thank you.
And they want to supply the care that the individual require, but not bounce back and forth. So you can see there's a logic to it. So it actually works pretty well. What supplemental plan would be the best in instances above, please? And how much do supplemental plans cost if one already has A and B, especially if one has never used medical care or prescriptions, please? I think this is where, as we're getting late, I think this might be, please call Jim and Katie.
Yeah, we don't want to talk costs because they're dependent on where you live, how old you are, stuff like that. So
all states are different. It's the zip code. It really depends.
Yeah.
So, but you can always shoot us an email and we can send that back to you.
Yep.
So here's our last question for this segment. I have United Healthcare Medicare Advantage Patriot, no medical, no RX plan that gives us a rebate on Medicare Part B since TRICARE would cover our prescriptions if we ever needed them. Does that provide the same coverage for an F or G plan that an F or a G plan would cover?
No, it would still be an Advantage plan. So you still have to stay within their network of providers. So it would work the same way as other Advantage plans. The only thing is that you would not be penalized on the prescription drug side because there's no prescription drug coverage in that plan.
Normally those are so like people with VA veterans benefits.
Or TRICARE,
especially with the VA because they have prescription drug coverage through the VA. So they can purchase that plan, right, as a VA. But we're not talking about Christian Scientists. So then again, you go back to the network, and Katie's right. There are no Rinkies on that network, if that makes sense.
Jim and Katie, thank you. And Nancy, these webinars are always helpful. You can see these questions are tricky. That's why
they are.
It's really helpful to call Jim and Katie because They deal with this day in and day out, and it's tricky, as I keep saying. So please don't hesitate to call any of these three with Medicare or insurance-related questions at any time. They're happy to help. One other resource you are welcome to contact is the Christian Science Provider Network, or CSPN, which works directly with Medicare and insurance companies on behalf of Christian Science care facilities, as well as individual Christian scientists. Another resource for financial assistance available to Christian scientists of any age is the National Fund for Christian Science Nursing, or the NFCSN. The contact information for these and other resources is listed at the end of today's webinar. So just stay tuned right after we conclude here. Again, the point of this is that it's wise to be thinking through your options now. That's why we offer these webinars. So we hope it's been helpful. Before you go, I want to remind you to check our website, ardenwood.org, for details about the upcoming webinar events, such as the long-term care insurance webinar in late March, and also our upcoming annual meeting, the Ardenwood annual meeting on Sunday, May 4th, the first Sunday in May, at 2 p.m. Pacific. Thank you again for joining us today, and goodbye for now.
Bye, everybody. It was nice talking to you.
Bye.